get started, which I'm always excited to do these, and I'm rather excited about this particular topic matter. It kind of establishes the premise of really what we do and why we do it. It kind of feeds into, honestly, all the other topics that we talk about, and I hope that kind of makes sense by the time the night's out. Before we actually get underway, though, I was actually had the idea of using somebody as a test subject, if possible, and was curious if anybody actually happened to have either a shoulder problem or a hip problem that'd be willing to get up later in this presentation and be a part of the presentation. And if not, that's totally cool. Kind of do?
Yeah, it's mostly from stress. I hold it all on my shoulders.
Well, that's perfect, because that's what we're talking about. Are you comfortable doing that?
Sure.
Yeah? Technically, I have to have you sign a form really fast since you're not a client of ours. But just the information and then sign and then initial there. And then this is the media, like if you're cool letting us do it on video. If you're not, then we can always turn the video off and just do that part. Because I'd love to be a part of the presentation. If you'd rather not be on the video, we can turn the video off for that part. I actually gotta make sure you can actually see me standing in front of the table. I just did just a little bit that way.
One of the other things, just by way of introduction with the topic, if you have something particular that you're looking for us to cover in relation to trauma, let us know.
Yeah. Yeah. So always open to questions throughout the whole process. And then if at the end we always open it up to questions specifically. So if something, so always just throw it out there. Cool. So tonight's talk is understanding and treating trauma. And so in the background there you have this idea, PTSD, flashback disorders, fears, depression, anxiety, all those types of what are typically deemed as kind of psychological type disorders, with the PTSD one being the big one in the center. And a lot of the stuff from this actually presentation that we're going to be presenting tonight came by way of a book called The Body Keeps the Score. And I wish I could tell you the doctor's name, but it's kind of a complicated one. And so The Body Keeps the Score is the name of the book. And he's actually helped create the diagnosis of PTSD. And it's a really fascinating read. And he ultimately goes into different types of therapies that he kind of learned about and became a part of to kind of help with some of those past traumas that have occurred to people. And I hope we do a good job of kind of presenting that connection and why some of the kind of more simple physical type treatments can actually have a big effect on our psychology as it all gets connected in terms of neurology, brain function, and how the body functions. And so again, the PTSD being the idea of post-traumatic stress disorder, that a trauma has occurred in someone's life. And we often perceive that trauma has to be large scale. It does not. And that's something we're going to talk about, like why it doesn't have to be large scale, and how that process occurs, and then what the connections and everything are. So, cool.
One little thing on that book, if you don't like detail of stories, they go into very, very precise detail. So if you don't want to read, don't read it.
The body keeps the
The body keeps the score.
A little bit more detail than I like, even. So just to give you an idea.
The first half, it's kind of his thought processes and the different presenting people that came into his practice that he talks about. And then the second half is kind of the more breakdown of the kind of more intimate type traumas and things that actually occurred to people. So there's just different ways to, that process. Perfect. So by way of introduction, so I am Dr. Quinn. It's Dr. Richu here. We're both doctors of chiropractic that have further training in what's known as applied kinesiology, which we are going to get into that, and that's going to be some of the presentation tonight actually on the table, is how we use the art or the technique of applied kinesiology to actually identify and release traumas. Tonight we're going to present it more in a physical sense, which is why I asked for a more physical type trauma, but it gives you the idea, because sometimes on the emotional stuff it becomes a little bit more, again, personal and intimate in those conversations. So to just kind of present how we're able to use it for those purposes. Any introduction to yourself?
Thank you, pretty much so.
Okay. Cool. So trauma I threw this up because this is the, we call the triad of health. This is the premise by which really the holistic arts operate, holistic medicine across the board. There's very few practitioners in our field that don't have this up on their wall, or again, any of the holistic fields. And it's the idea that, we're just going to get to more in the next slide, but these are the three sources of trauma. So structural, chemical, emotional. Structural is not, so structural a lot of times is the more easy one to point at. It's the one that kind of manifests more. Again, I asked for does someone have a shoulder problem, physical injury. People have been in car accidents, sports injuries, falls, all those different things. Chemical, even nowadays, is I think a little bit easier to assess as we have things like blood work to identify those things. We have things like allergy testing to identify some of those sources of chemical stress. The harder one is the emotional stress. I just realized the sheets of paper I forgot to bring to this presentation. That's a little annoying. I was going to have there's a little questionnaire thing that I'll talk about, but I forgot to bring it, so we won't actually have it. But it's a little bit harder one to identify, and also to identify how it's affecting everything else. And that, as they go further into this, they're realizing that psychological stress highly affects everything else in terms of our chemistry and physical pains and how that all gets connected together. And so the next slide is how this kind of works. So what is trauma, physical or chemical or emotional stress? And again, sometimes that's large scale, sometimes it's smaller, sometimes it's the day-to-day grind of work creates that emotional stress. I know most people that come into our office talk about tension in the shoulders, that kind of stress. There is a neurologic connection for that. There's a reason why stress in one's life creates tension in the shoulders. So what I wanted to present with this, and you're actually going to see the slide later on again, is that the issue with trauma or the issue with stress in people's lives, I kind of use those two a little bit interchangeably, is that when we get presented with a trauma, our body has three options of what to do with that trauma. So one, it can fix it. So again, physical is probably the easier one to describe. So if you have an actual direct hit to the shoulder or a football injury or sports injury to the shoulder, it has the option to fix it. If it has all of but the key to that is it has to have all of the available resources in order to be able to fix it. So all the nutritional supplement, like chemistry, needs to be there. Like you have to have your protein structures, you have to have your cartilage structures, all the different components to actually do the healing process in the shoulder. Those have to be present. A big issue that we run into in our world is the injury itself has to be nice enough that it didn't displace anything. If something gets displaced, your body doesn't actually have the necessary components to truly fix the injury. Its only other option, next option is the next one down, which is to adapt. So it can adapt to that injury. When it comes to physical components, again, easier to explain. So people often come in and they say, 6 months ago I twisted my ankle, couldn't hardly walk on it, but that problem went away and now my left knee hurts like crazy. Well, for 6 months, as you babied the right ankle, the body figured out how to adapt away from it, and now you're dealing with the left knee problem, right? So the body creates adaptations in order to move away from the actual injury or stress or trauma. When it comes to chemical or emotional things, one of the most common adaptations is actually what we call separation or segregation. If you've ever heard people talk about large-scale traumas, they'll often talk about it almost as a third person observing this trauma occur to themselves. And that can be as well physical, like big large-scale car accidents or other things. And a lot of emotional traumas tend to have physical components to them as well. So that's actually that's the adaptation process. And the moment that allows the body to withstand the physical trauma without breaking our mental selves. That's the purpose of that adaptation. And so in the short term, adaptations are essential. If the adaptation doesn't ever leave, it creates long-term problems. And that's the reason why I have this picture of the cup next to it. So the idea is that we are a cup, and as you have different stressors that enter our lives, it fills up. So with every adaptation your body has to make, it requires resources to sustain that adaptation. And so the cup starts to fill up and fill up and fill up and fill up. So this little thing on the side I cut it off. There's an E there that says environmental factors. So the water level is the environmental factors. Where you are is where you are now, is at the top of that water level. The only room you have left, which is what we call resistance, is the open space. When your cup flows over, that is what we call disease or dis-ease. And so you can only stack so many things on top of themselves until you all of a sudden end up with a problem. And as that starts to flow over, you start to then see symptoms. And we're seeing this more and more in the world of things like autoimmune conditions, where the symptoms are seeming to be very, very broad and expansive, is because you've reached this limit in many different areas of the body, and your body's now having an issue of how it's dealing with that. And so your last option, which is true, I don't like putting it up there, but is to die, right? If the trauma is large scale enough and it does not have the capacity to fix enough things or to adapt to enough things, ultimately that's what actually happens. And so people often sit, because by the time people come into our office, they're already experiencing symptoms, they're already experiencing things in their lives, and they realize that something is wrong. This actually infers that they're already sitting at that brink. And so you often will see this, is that a lot of times we'll fix one component, people will feel way better, but then 2 months later they start presenting with another issue. And the reason why is that you didn't dig low enough down, you didn't remove enough of this water and these layers of trauma to be able to allow the body to actually start to heal and fix itself. So that will be the premise. We're going to go through a little bit of kind of chemistry here, a little bit, or anatomy over this next little part to explain this. Next one. Oh, actually, so no, prevalence. So prevalence of trauma. So I do want to hit on this, that the childhood trauma actually tends to create the biggest issue in people. And there's this kind of perception in psychology that, like, oh, if you go talk to psychologists, they're just going to say, what happened to you when you were 5, or how was your mom, or how was your dad. The reason why is because it creates the most lasting effect on us. As children, we actually learn extremely quickly. The example that we always give is hot hand on the stove, right? If a child puts their hand on a hot stove. If a child puts their hand on a hot stove, right, the body creates a signal and then creates a scenario where it says, we know what to do when this happens. And so as a child, it will happen very quickly. That neurology will get laid down almost in an instant. As an adult, it requires repetition of experiences in order to lay down the same neurology. And so that is why, as a child, we become much more susceptible. And so if people grow up in environments where there is abuse, they learn something from that at a subconscious level. If you have someone that is abusive or yelling or screaming, you learn that you don't want to interact with people, or that's going to be the result. And so even though you become an adult, there's this part deep down in you, your subconscious, that still says, I'm going to be anxious around other people, or maybe it's just a male figure, or maybe it's the female figure, or something that connects back to that childhood trauma. There's still a signal being sent that says, we are concerned about this situation, okay? And so because of that, you're going to get some of those anxieties and things that come with it. And this is prevalence. So there was a study done, we call it the ACE study. It's Adverse Childhood Experiences. And what I meant to bring with me tonight was actually the questionnaire. I wanted to hand it to everybody, and I left it back in the office. So you can actually Google that, like the ACE study questionnaire. And it was only, I think it's 12 questions, and it's really rather simple. There are questions like did you ever witness one of your parents being physically abused? Were you ever physically abused? And things like that as it goes through that questionnaire. And so the idea is you just put a 1 next to each mark and you kind of get your total. And so from this study, over 17,000 people voluntarily participated in this study, and this is what they determined, that over 20% experienced 3 or more categories of trauma, which we call adverse childhood experiences. And then 63% of people participating in the study experienced at least 1 category of childhood trauma. So from this study, 11% experienced emotional abuse, 20 experienced physical abuse, 21 experienced sexual abuse, 15 experienced emotional neglect, 10% experienced physical neglect, 13% witnessed their mothers being treated violently, 27% grew up with someone in the household using alcohol or drugs, 19% grew up with a mentally ill person in the household, 23% lost a parent due to separation or divorce, and 5% grew up with a household member in jail or prison. Those numbers are actually quite large. When you say 28% of the population, you're dealing with 30% of the population, right about, or 1/3, or close to 1/3. And so the result from the study also showed, next slide, if you can hit that, is that from this, as they looked at people that had experienced traumas, when you actually started going into it, especially individuals that had 3 or more of those categories that they could check the box, these were the percentage likelihood that all of a sudden things went up. So 15% more likely to commit suicide, 2.5 times more percent likely to smoke tobacco, 3 times more likely to have serious jaw problems, 3 times more likely to experience depression, 4 times more likely to become an alcoholic, 4 times more likely to develop sexually transmitted disease, 4 times more likely to inject drugs, 3 times more likely to use antidepressant medications, 3 times more likely to be absent from work. So this was actually a pretty kind of like groundbreaking study when it came out, showing that this stuff really does matter. And why does it matter? And that's going to be the next part. So our nervous system has 2 sides to it, what we call the sympathetic and the parasympathetic nervous system. And the sympathetic is what we call fight or flight, and the parasympathetic is what we call rest and digest. It calms your body down. And so for a long time, since actually the work of Darwin, there you go, since the work of Darwin, we thought it was that simple, that it was either this side or that side. So it was either run away and hide, or fight, or rest and digest. And the component to that was, so then the thought was you had 2 different sides to how you would react to something. When a stressor came into your life, you could either fight it or you could run away. And the idea was that it must be that this parasympathetic side does not enact during times of these stressors. And so you have people, and when I say that, even fight or flight, people can often say that or see that in their lives. Most people know somebody that when a stress happens in their lives, they get really angry and they are ready to just either go at it with the person or go at the problem, or just like, we're going to take this out, right? That's that fight kind of response. Flight is, people know this as well, people are familiar with or even have in their own personal dialogue, right? That when serious things get troubling in life and things get difficult, there's this part of you that starts saying, well, I could just quit my job and leave and move away, right? Like there's this part of you that is there that kind of wants to do this.
I would even venture to say the simplistic thing of having a brother or sister or a friend scaring you. Your eyes get dilated, your heart rate jumps up, you're ready to go.
You're ready to go. Yeah, no, that's perfect.
We all have that.
We all have that. So that's the response that occurs, is that we get dilated eyes. Yeah, exactly. Heart rate starts racing. And that's a natural response to try to get us prepared for this like stress that's occurring or about to occur in our lives. And so when you move forward into some of these psychological conditions of depression, PTSD, anxieties, especially anxiety, you look at that and you realize what's happening is that natural response is starting to occur to too many things in your life. People get in the car and they get scared of driving, and all of a sudden their heart rate goes up and they're dying, and it's just this like whoa, what's going on? That's the anxiety response, and that's how most people will describe it. And what starts to happen is people even get that response in reaction to their own thought process of like, I feel overwhelmed, and then they start setting off, I feel overwhelmed. And so what came along though, and this is actually a more recent realization, it's called the polyvagal theory, is that this parasympathetic nervous system, so which I showed a picture of it but didn't describe it well up here. So there is a nerve that exits from the brainstem, so part of our kind of subconscious control, that runs down and connects to the varying organs of the body. And so this nerve, which you actually see in that picture, is what is supposed to enact what we call the parasympathetic nervous system, which is the rest and digest. It's the calm you down. Most people, upon having something occur or stress or something catches us off guard, you have an initial sympathetic response, but then that parasympathetic should take over and allow you to calm down. And so the doctor, or the individual that kind of developed this theory, came to the realization that parasympathetic system pretty much has to be trained, would be the way to explain it. So it's actually most primitive control, most primitive response is actually not exactly calming and soothing, it is actually freeze, what we call freeze. And so people have seen this as well, and people have responded. If you think about it yourself, your experiences, something occurs, and as opposed to taking action in a traumatic event, you just kind of shut down. And you just go, man. And this can escalate to all of a sudden almost on a day-to-day basis, where people know I have X, Y, Z to get done today, and as opposed to being like, yeah, let's go do it, their response is, oh man, like I can't even bring myself to go do that. That's way too much going on, and they kind of shut off. So it does slow metabolism, it increases the pain threshold, it lowers heart rate, and it creates overall muscle weakness. There's a lot of other things that it does, but that's what they came to realization is this is the primitive response. I probably have the most perfect, that I've seen anyways, experience with that. At a certain part of my life, when I was actually in chiropractic school, I started having what we call petit mal seizures, which is because it's a seizure that happens. It's not a shaking, but it is actually a complete shutdown. It is this effect happening. So very small things start acting as stressors to me, and we'll get into later on why that actually occurred. But because of an overload that was happening to me chemically, all of a sudden my stress threshold, like that cup of water, started overpouring. And so anything that would cause me stress, which socialization can often cause me stress in general, would actually set off this response, and I would just shut down. And so I could hear people talking to me, but my facial expressions just blanked out. I had no physical capacity to respond to them, and I just kind of couldn't even move. And it would last for a period of time. And then interestingly enough, the way my body, I would actually breathe in really deep, and it would kick me out of it, and then all of a sudden I could kind of get back to operating. And the breathing in thing is part of this control. It was actually my other systems kicking in to kind of force me out of it. And so that's the kind of thing that can happen. And so at the bottom it says the more advanced response, which is kind of that more calming and soothing, actually is supposed to be social communication. Social communication is not supposed to be scary. Again, on account of childhood traumas that often can get associated with things that are traumatic or scary. And I don't mean standing up and talking, I just mean person-to-person communication. And then self-soothing is another mechanism that we're supposed to learn. We're supposed to develop that as we go through childhood, young adult years, develop these and further advance that so we increase its capacity so that when a trauma does occur, we have something to rely upon to calm us down and do those things. And this is how this actually system works. So this actually brings us back to this, and I'll kind of just hit it one more time, and then I'm actually going to turn the time over to Dr. Gabe. So that's the whole component of understanding trauma, because that's actually what's happening. That, again, initial PTSD diagnosis is a brilliant diagnosis because it infers that we have a current response to past traumas. And that is what starts to shut us down. And it starts to shut us down in more ways than we realize. Again, if you think about some of the things we just talked about, that's that water, again, elevating. The more things you have of this in your past, the higher that water actually elevates. And so because you have all this going on, and so people will often feel like they're spinning their wheels trying to figure this out, when what it's looking at is kind of deeper things that have occurred in our past. Even when, and I hear this a lot with people, because I'll identify, through our procedures, I'll identify past traumas in their life, and they'll say to me, yeah, but I forgave that individual, or yeah, I've moved past that. I don't want to keep going back to that. And that's totally fine, and I absolutely believe that mentally you've managed to override that, but there's still like a subconscious, just neurologic response that occurs, and that's what they're being able to identify of what we can kind of disconnect and alleviate. We can release that response of the trigger effect to have such an overwhelming neurologic effect. Because if you have moved past it here, then we should be able to get your body to physically move past it kind of internally. So now we're going to go over this idea, right here, and how you work with, and kind of some of the things that we do to work with these scenarios. So.
All right, so just going back to that same thing that Dr. Quinn was talking about with the jar filled with water, or the cup filled with water. That's the same thing we're talking about here. How do we increase that jar size so we can handle more stress? Some of us probably have had a decreased size in that jar due to the traumas we've had. In addition to that is how do we remove the stressors in the jar anyways? And so that's what we're going to be talking about. So keep that in mind. So this is one of my favorite things to talk about with everyone. I had to talk about somebody today, a new patient that came in. him, them some, or they themselves were dealing with diabetes, among other things. And it's a bit of uncontrolled diabetes. So type 2 diabetes is typically controlled with oral medication. And when it's uncontrolled, they're usually on insulin and they're eating what they shouldn't be eating. With that type of a situation already, I'm like, oh no, this is going to be hard. Because it's a complete lifestyle change. That is the thing that we hit on with every single patient. It's not this wonderful little Jenny Craig diet. It's not Weight Watchers or anything like that. Your entire lifestyle is going to change, and it has to change. We're not going to ruin your life. We want to be with you each step of the time, of each day as we progress towards this. But diet is huge. The Standard American Diet, I always love that one because you can make the acronym of SAD diet. It is truly SAD. What we eat is mainly carbohydrate in the form of processed refined grains. You can throw the meat in there, but usually it's this poor quality meat, poor quality proteins. And then tons of other processed junk, just tons. And if you just think of a typical McDonald's supersized meal, I guess they don't do supersized anymore, but whatever. That is what we're talking about with Standard American Diet. But when it comes to true lasting health, and we will always give very general guidelines to it, because when you look across the world with indigenous populations and through our ancestors, everyone ate a little bit differently, depending on the climate and depending on what their needs were. The Inuit in Alaska eat almost 100% animal product diet. 80% from fat coming from blubber, or their calories coming from blubber, and then the rest protein. That's what they eat because they have no other choice. They're in the Arctic. Then you have the Kitavans in the Kitavas Islands who eat 70% of their calories come from carbohydrates, such from root vegetables such as taro and cassava and other things like that. But then you have the Maasai in Africa who do a completely different thing, more animal product based. But what we're seeing is there's a great variation. The Okinawans eat a diet that allows them to have virtually no chronic disease. And then the people who live in the northern regions of Pakistan, up in the Himalayas, they also have a similar type of no chronic disease, and they eat pretty much whole foods. And that's what we're going to hit on. It's real food that hasn't been adulterated by us, by putting tons of chemicals and things like that, like Roundup, since that's been in the news, and genetically modified. It's going to be a lot more plants. Most of it will be plants. And it's going to be, don't eat too much, because we like to gorge ourselves just a little bit on the amount of food that we eat. Nuts, great. I always say don't go too crazy on the grains. For my own personal belief, I think they're a great famine food. They store for 30 years easy. You can always eat them. But when we talk about nutrition, and there's a term called, or a designation we'll say, nutrient density, the amount of nutrients that something has, not just your carbohydrate, protein, fat, but the vitamins and mineral makeup, the phytonutrients that are in it. Grains are not that great when it comes to that side of things. The number one is spices and herbs. That's actually number one. But most of us are not going to take a thing of turmeric and down it, or a thing of rosemary or anything like that. We're not going to do that. But using more would be preferable instead of salt and pepper like we usually eat. I always use the Indians as a good example because I love Indian food, and they use a lot of spices in their meals. Almost the whole recipe is just spice. But taking that aside, the number one nutrient-dense food in the world is liver. Grass-fed liver has the most. Something that we do not like to eat in America. Organs, ugh, gross. That's why we offer it in a capsule form, because I don't like it either. My parents love it. My mom, I remember coming home from school and I could smell it before I entered the door. There was liver and onions being cooked. I knew what it was. But outside of that, fermented foods. Fermented foods, and we're not talking about the pickles you can get here on the shelf, but the pickles you can get in the cooler section. They actually have fermented, some little microbes and bacteria in them. And you can,
Active, live.
yes, they're active, they're live, they're not pasteurized, dead. So that would be the other thing. And you can make them yourself, you can learn to do that. We make our own sourdough bread when we want to have bread. You can definitely learn how to do that. It's just takes some trial and error and some fun experiments. The last thing I want to hit on is local organic is always best. We love natural grocers because sometimes we just don't get stuff here locally, but if you have the ability to get things local, please do. The nutrient density is way higher. When you pick spinach within a few weeks, the vitamin C, iron, and other levels drop dramatically. And by the time you end up eating it, it's probably been months since it's been picked. Okay? Just to give a little bit of an idea. Even if it's organic, that's going to be the case. Movement. This is going to go really big into structural side of trauma and fixing that side. Before I touch on the movement and how it helps, let me touch on structure a little bit more. So we do something called myofascial release. Anyone heard of that? Okay. Anyone know what fascia is? Or fascia? Okay. So it's the connective tissue that covers our muscles, and it's more than that. There's also this gel-like layer component of fascia that we've recently discovered due to a new way to embalm bodies. We found this little layer that is head to toe throughout the entire body. And there's a wonderful, long designated name to it, scientific name that I don't even have memorized. But to give you a little bit of an idea, there's little vacuoles, little 3D volume structures that are in a fractal-like pattern.
The what like that?
Fractal-like pattern. And what we're realizing is that the fascia is meant to glide with us as we're moving. And so the person who discovered this is Dr. Guillaume Barteau out of, he's from France, obviously, but he's in Scotland doing all the research. But what he realized is that when you make a movement such as this and this, we see the same movement with our eyes. But microscopically, they're two completely different movements because the conditions around it changed. Just like you can't step into the same river twice. It's the same thing that happens with our fascia. The interesting thing with fascia is it can become restricted. And when it becomes restricted, it's due to trauma of some sort, whether it's chemical, emotional, or structural. From the structural standpoint, just like the whole shoulder injury, these restrictions will occur, and then all of a sudden, oh, my shoulder hurts. Let's say it's somebody who has a frozen shoulder. Has anyone heard of frozen shoulder? Can't lift your arm up. That usually spontaneously occurs without a trauma attached to it. No one hits you, nothing like that. And so then the investigation goes, let's look at the shoulder and let's see what's going on there. The unfortunate thing is they're not thinking head to toe with the fascia. The fascia is one continuous structure. I had a frozen shoulder patient 2 years ago. She could lift her arm. It was in the